So President Biden is expected to return to the White House later on today. He has been self-isolating at his home in Delaware after testing positive for COVID-19 last week. The president's diagnosis has placed a renewed spotlight on the virus and what precautions should be taken. So joining us now to break this all down is CBS News medical contributor Dr. Céline Gounder. She's also the editor-at-large for public health at KFF. Doctor, good morning. So when I found out about, the president's diagnosis, suddenly I was like, what is the current protocol? So what are the guidelines coming out of the CDC when it comes to COVID, if you catch it?
Yeah, those haven't really changed in a while now. So if you have COVID, the advice is for you to stay away from others, so to isolate at home so that you're not exposing others until at least 24 hours of symptoms improving and being without a fever. And that fever should not be treated with something like Tylenol. It should have resolved on its own.
So do you have to test negative, though? Like, remember before you had to get 2 negative tests in a row?
Well, what the current advice is that you should isolate for ideally 5 days. That's the period of peak infectivity. It's not that you could not still be infectious after 5 days, but that's when the risk is highest. If you do want to be more cautious, having 2 of those at-home rapid tests is still the best advice. And remember, there are ways other than isolation and masking to reduce the risk of transmission, such as opening windows, having HEPA air filtration units to reduce the risk of transmission in the air, and then also just testing to see who's been exposed, who's currently infectious, and reducing risk that way.
Really quickly, doctor, after the president's diagnosis, 2 other people I know told me that they had also tested positive. Are the numbers going up?
The numbers are very high right now. We're seeing it in wastewater, sewage, water, and we're also seeing it in people. And it's because people are indoors, perhaps because it's hot. They want to be in the air conditioning. They're gathering vacation months, and people just aren't as much attention to mitigation measures anymore.
All right, Dr. Céline Gounder, thank you very much.